Dear audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's lecture on pathology. Today is the 22nd lecture on pathology. Today, day 8 of lecture on inflammation. On day 7, I have told you about definition, types and causes of chronic inflammation. Today's topic is chronic inflammatory cells. Now come to chronic inflammatory cells. Now come to chronic inflammatory cells. The name of chronic inflammatory cells: macrophage, lymphocyte, plasma cell, epithelioid cell, giant cell. So macrophage, lymphocyte, plasma cell, epithelioid cell, giant cells, these are the chronic inflammatory cells. We can recapitulate. There are acute inflammatory cells like neutrophil, eosinophil and basophil, and these are the chronic inflammatory cells. At the site of chronic inflammation, these chronic inflammatory cells are found. Now come to first macrophage. Dear audience, you know in blood monocyte is one of the WBC cell, monocyte. When this monocyte comes in tissue, it is converted to macrophage. So macrophage is derived from monocyte, and we can recall tissue monocyte is called macrophage. What is the role of macrophage? Now come to role of macrophages. Role of macrophage: phagocytosis. So this is the important phagocytic cell. It is also called scavenger cell. It is associated with scavenging, so it is called scavenger cell also. Another function is presentation of antigen. Presentation of antigen to immune system. Presentation of antigen to immune system. Another role: secretion of a variety of products. Secretion of a variety of products like interleukin 1, IL-1, interleukin 1, like TNF, tumor necrosis factor, interferon, which one is antiviral agent, It is associated with secretion of chemotactic factors. Chemotactic factors or chemotactic agents. These chemotactic factors or chemotactic agents are associated with the recruitment of neutrophils. Other role of macrophage: modification to epithelioid cell. Modification to epithelioid cell. Macrophage is modified to another chronic inflammatory cell, that is modified macrophage. It is called epithelioid cell. Another function: macrophages fuse together and forms inflammatory giant cell. Inflammatory giant cell. So many macrophages fuse together and forms a single cell containing multiple nuclei, and the cell becomes larger in size. This is called inflammatory giant cell. So these are the functions, role of macrophages. Now come to another inflammatory cell, lymphocyte. Lymphocyte. You know there is T lymphocyte and B lymphocyte. What is the role of lymphocyte? Production of lymphokines. And these lymphokines are associated with activation or stimulation to monocytes and macrophages. This lymphocyte stimulates or activates monocyte and macrophage. So these cells are stimulated by lymphokines. Now come to plasma cell. Dear audience, you know plasma cell like this. The nucleus is eccentrically placed and there is cartwheel appearance. So this is the plasma cell. The plasma cell, you know, is derived from the proliferation of B lymphocytes. It is derived from proliferation of B lymphocytes, and from the proliferation of B lymphocyte we get plasma cell. And the role of plasma cell, production of antibody. Dear audience, among the all chronic inflammatory cells, lymphocytes is the hallmark of chronic inflammation. Again, we can recapitulate. Lymphocyte is the hallmark of chronic inflammation. Now come to epithelioid cell. Respected audience, it is epithelioid cell. It is not epithelium. It looks like epithelium both structurally and functionally. So what is epithelioid cell? A chronic inflammatory cell. It is a chronic inflammatory cell that structurally and functionally looks like epithelium. Looks like epithelium both structurally and functionally, but actually not epithelium. Such type of cell is called epithelioid cell. So it is not epithelium, but structurally and functionally it resembles with the epithelium. So it is called epithelioid cell. Actually it is modified. It is modified macrophage. Actually it is modified macrophage. So if you think from blood, this is the monocyte. When it comes in tissue is known as macrophage. And when the macrophage is modified, then it is called epithelioid cell. So from monocyte we get macrophage, and from macrophage we get epithelioid cell. Now come to what are the modifications occur in macrophage to become epithelioid cell. What modifications occur within the macrophage to become epithelioid cell? Modifications occur in macrophage to become epithelioid cell. What modifications? Number one modification, the cytoplasm that was present in the macrophage becomes abundant, and the cytoplasm within the epithelioid cell become pale pink. So pale pink, abundant cytoplasm. Pale pink abundant cytoplasm. Dear audience, you know, if this is the columnar epithelium, if this is the squamous epithelium, you know the nucleus is smaller than cytoplasm. In epithelium, the cytoplasmic volume is more than the volume of the nucleus. So in macrophage, what happens? First modification, the cytoplasm is increased in amount and the cytoplasm become pale pink, and the amount of cytoplasm within the epithelioid cell like that of the epithelium. So pale pink abundant cytoplasm is the first modification. Another modification, the cytoplasm of epithelioid cell is rich with what? Rich with endoplasmic reticulum. You know, endoplasmic reticulum is associated with synthesis, and it is rich with vesicles, and cytoplasm is rich with secretory vacuoles. Our epithelial cells are secretory. We don't get such type of secretions from the macrophage. When the macrophage is modified like this, the modified macrophage becomes secretory because it contains secretory vacuoles, vesicles, and endoplasmic reticulum, like that of the epithelium. Another modification, you know, macrophage is the potent, very important phagocytic cell. The phagocytic activity of the cell is lost, and the modified macrophage become secretory. Cells become secretory. So the cell that was phagocytic, the cell is converted to secretory like the epithelium. So this is the modifications that occur in the macrophage to become epithelioid cell. Now come to giant cell. First we have to know what is giant cell. Large cell containing usually multiple nuclei, or large cell containing single large nucleus. Large nucleus is called giant cell. So by definition, this cell is large one. It contains multiple nucleus like this, all are nucleus. By definition, this is giant cell. And another one is cell is large and it contains single large nucleus. This is the nucleus. So by definition, large cell containing multiple nuclei or large cell containing single large nucleus is called giant cell. So both are giant cell. Now come to types of giant cell. We have got different types of giant cell. What are those? One is inflammatory giant cell, and another is tumor giant cell. Another is tumor giant cell. First come to inflammatory giant cell. Inflammatory giant cells are found in different types of chronic inflammation. Now come to what are different types of inflammatory giant cell. Different types. Langerhans giant cell, Langerhans giant cell, foreign body giant cell, Teuton giant cell, Teuton giant cell, Warden-Finkeldy giant cell. Warden-Finkeldy giant cell. So these are the inflammatory giant cell. Now come to first Langerhans giant cell. Langerhans giant cell. What are the characteristics of Langerhans giant cell? Characteristics of Langerhans giant cell. Characteristics of Langerhans giant cell. Large cell. Cell is very much large cell. Suppose this is the large cell. Then multiple nuclei. Multiple nuclei. And the nuclei are arranged at periphery of cell, at periphery like horseshoe. So large cell containing multiple nuclei, and nuclei are arranged at periphery of the cell like horseshoe. Suppose the red are the nuclei, multiple nuclei, they are arranged at the periphery of the cell as horseshoe. You know, this is the horseshoe. One end that is open and all along it is confined. Like this, the nuclei are arranged at the periphery all along except at this part, and this part is devoid of nucleus. So arrangement like this, it is called Langerhans giant cell, and due to arrangement of the nuclei like horseshoe, it is also called horseshoe giant cell. Due to arrangement of the nuclei at the periphery like the horseshoe, it is also called horseshoe giant cell. So now come to where we can get in which type of inflammation, or what is the inflammation where we can get Langerhans type of giant cell. This type of giant cell found in tuberculosis. So at the site of tuberculosis, either pulmonary or extrapulmonary site, if we examine under microscope, we can get caseous necrosis. At the same time, we can get Langerhans type of giant cell. Now come to foreign body giant cell. foreign body giant cell. What are the characteristics? Characteristics of foreign body giant cell: large cell, multiple nuclei, and nuclei are arranged haphazardly. Haphazard arrangement of nuclei. Multiple nuclei, haphazard arrangement of nuclei. Suppose this is the large cell, foreign body giant cell, and red one is the nuclei. These are not arranged systematically, but there is haphazard arrangement. So haphazard arrangement of nuclei. Where we can get foreign body giant cell in chronic inflammation caused by foreign body like silica, found in chronic inflammation caused by foreign body like silica. Now come to two-tone giant cell. What is the characteristics of two-tone giant cell? Characteristics of two-tone giant cell, like before, it is also large cell. The cell is very large, multiple nuclei, and nuclei are arranged at the periphery of the cell like necklace. Nuclei arranged as periphery of cell. So nuclei are arranged at periphery of cell like necklace. If the red one, all are nuclei, so the arrangement of all red nuclei like necklace. This is two-tone giant cell. Where it is found? It is found in xanthoma. So this is the two-tone giant cell. Another one is Warthin-Finkeldy giant cell. It is found in measles. Now come to how the foreign body giant cells are formed. A single cell containing multiple nuclei in chronic inflammation. How single cell contains multiple nuclei, that is how foreign body giant cells are formed. How inflammatory giant cells are formed. Dear audience, you know inflammatory giant cell is found in chronic inflammation and it is large cell containing multiple nuclei. So how a single cell contains multiple nuclei, that is how inflammatory giant cells are formed. Formed by fusion of macrophages. It is formed by fusion of macrophages. I have told you one of the role of macrophage, many macrophages fuse together and form inflammatory giant cell. So inflammatory giant cells are formed by fusion of macrophages. Suppose this is a macrophage, this is another macrophage like this. This is a macrophage, and this is macrophage like this. This is the macrophage like this. Suppose this is the nucleus, 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 nucleus. If the 5 macrophages fuse together like this, then you see single cell containing multiple nuclei. So these are formed by fusion of macrophages. Now come to tumor giant cell. Now come to tumor giant cell. This is the giant cell found in certain tumors. Giant cells found in many tumors, and these are called tumor giant cell. Now come to some examples of tumor giant cell. Examples of tumor giant cell: RS cell, Reed-Sternberg giant cell, Reed-Sternberg giant cell, RS cell, Reed-Sternberg giant cell. It is found in Hodgkin's disease. It is found in Hodgkin's disease. There are many types of RS cell, classical RS cell and variants of RS cell. I have told you giant cell may be a large one containing single large nucleus also. So one of the variety of RS cell, mononuclear RS cell, it contains single large nucleus. Single large nucleus. So this is one of the example of the tumor giant cell that is found in Hodgkin's lymphoma. The name of giant cell is Reed-Sternberg giant cell or RS cell. And this is the variety or variant of RS cell containing single nucleus. Another is giant cell of giant cell tumor of bone. A tumor that occurs in bone known as giant cell tumor. The giant cell tumor contains many giant cells. These are nothing but the tumor giant cells. So giant cell of giant cell tumor of bone is an example of tumor giant cell. So RS cell, giant cell of giant cell tumor of bone are the examples of tumor giant cells. RS cell is found, the name of tumor is Hodgkin's lymphoma, and giant cell found in tumor name is giant cell tumor of bone. Now come to how tumor giant cells are formed. We know inflammatory giant cells are formed by fusion of macrophages. Now come to how tumor giant cells are formed. How tumor giant cells formed. Dear audience, you know during normal cell division, during normal mitosis, prophase, metaphase, anaphase and telophase, you know, in normal mitosis, you know, if the mitotic cell, if the nucleus containing chromosome, you know, during cell division what happens? The cytoplasmic division and nuclear division run parallel and run parallel. Ultimately, the nucleus is divided and cytoplasm is divided and two daughter cells are formed. So nuclear division and cytoplasmic division run parallel, and there is division of nucleus and division of chromosomes is completed at the same time. In tumor, you know, in cancer, you know, there is rapid proliferation of cells. The rapid proliferation of cells. Due to rapidity of proliferation of cells, sometimes In cancer, in cancer, what happens? The nuclear division is completed before the completion of cytoplasm. What happens in certain cancers? Sometimes nuclear division is completed before the completion of cytoplasmic division. It so happens, if there is completion of nuclear division before the completion of cytoplasmic division, the cell contains more than one nucleus, and this is called tumor giant cell. By definition, large cell containing multiple nuclei, large cell containing single nuclei is called giant cell. So this is formed when nuclear division is completed before the completion of cytoplasmic division. So this is all about the chronic inflammatory cells. To adapt to this, thanks all.